Hi everyone, and welcome to my channel. Today we will talk about anal fistula and answer the following questions. What is an anal fistula? What are anal fistula symptoms? What causes an anal fistula? What are the types of anal fistula? How is an anal fistula diagnosed? What is the treatment for an anal fistula? What should I expect if I have an anal fistula? When should I see a doctor about an anal fistula? Now let's answer the first question. What is an anal fistula? Anal fistula is like a weird tunnel that goes from inside your anus to the skin outside. And it mostly happens in the top part of your butt, where tiny glands are located. If those glands get sick, the yucky stuff from the sickness can make the tunnel. And that sick gland is called a pocket of infection near your butt. Sometimes people also call it a perianal fistula. Perianal just means around your anus. These anal fistulas, or tunnels, are somewhat normal problems around your anus and rectum. It happens 2 times more often to boys and men. If your anal gland gets sick, about half the time you'll get that tunnel. And when a gland gets infected and makes a pocket of yucky stuff that needs to come out, that causes 75% of these tunnels. Second question, what are anal fistula symptoms? Here are the most common problems. Your anal hurts a lot and it throbs. It might hurt more when you go to the bathroom, cough, or sit down. Your anal might also be very sensitive if you touch it. Your anal gets puffy and red, either inside or around it. This means there's probably an infection under your skin. Liquid comes out from around your anus. This liquid could be pus, poop, or blood. It might also smell bad. Here are some less common problems. You get a fever. It hurts when you pee. It's hard to keep your poop inside. You might be able to see the fistula if you use a mirror, but you might not. Third question, what causes an anal fistula? Fistulas can happen anywhere in your body. Fistulas are like tunnels that connect 2 different body parts, or a body part to your skin. Fistulas usually happen when a part of your body is swollen and irritated for a long time because of an injury or sickness. When an area is swollen and infected for a long time, it can damage the tissue around it, especially when there's pus that needs to come out. This can make a tunnel between the damaged area and the tissue nearby. But the most common reason for an anal fistula is an abscess near your anus. This abscess usually starts when a gland near your anus gets infected. An abscess is a pocket filled with pus that forms where there's an infection. The pus needs to come out, so it might make its own way out through a tunnel to your skin. Sometimes, a doctor makes a tunnel to drain the abscess, but often, the wound doesn't heal all the way, and that leaves a fistula. Other less common reasons for anal fistulas include inflammatory bowel diseases, like Crohn's disease, sexually transmitted infections in your anus, tuberculosis that affects your anus, an injury or surgery you had near your anus, radiation treatment for cancer in your lower belly area, actinomycosis, which is a rare infection from bacteria that makes abscesses, sometimes near your anus, hidradenitis suppurativa, which is a long-term skin problem that makes abscesses in your sweat glands, sometimes near your anus. Fourth question, what are the types of anal fistulas? Your doctor might use a special name for your fistula based on where it is. Here are some examples. Intersphincteric fistula. It goes through the inside butt muscle and then out between the inside and outside anal muscles. Transsphincteric fistula. It goes through both the inside and outside anal muscles. Suprasphincteric fistula. It goes through the inside muscle and then around the outside muscle. Extrasphincteric fistula. It goes around both anal muscles. This type is less common and usually starts in your rectum, not your anus, so it's not from a gland. Superficial fistula, it goes from the lower part of the anal canal, under the glands, and through the nearby skin, avoiding the muscles. This type is also not from a gland. You don't need to remember the name of your fistula, but the type matters for how your doctor treats it. If the fistula involves a lot of your butt muscles, fixing it can be harder. Doctors have to be very careful not to hurt these muscles when they fix your fistula. Fifth question, how is an anal fistula diagnosed? Doctors can usually see an anal fistula when they check your body. But sometimes, the outside hole is closed. Your doctor also needs to find the hole inside your anus. This might hurt, so you might need medicine to make you numb. If it's too painful to check inside your anus in the doctor's office, they might need to check you in a special room while you're asleep. To see the inside hole, your doctor might use a small tube with a light. Sometimes they put a special liquid into the outside hole. This liquid helps them find where the infection started inside. Seeing the inside hole helps the doctor know for sure you have a fistula. Sixth question. What is the treatment for an anal fistula? Most of the time, you need surgery. Usually, if it heals on its own, it comes back with more infections. Sometimes medicine can help. If the fistula is caused by a bowel problem and isn't infected, medicine might work. Doctors may try strong medicine before surgery. Surgery can be easy or hard, depending on how complicated the fistula is. Simple fistulas are easier to fix in one surgery. Harder ones might need multiple surgeries, but the simple fistulas are small. They only affect a little muscle. The usual surgery is called a fistulotomy. The doctor cuts open the fistula so it can heal from the bottom. This works very well. The doctor might also remove bad tissue. Cutting a little muscle is okay, but too much can cause problems with controlling your bowel movements. But the complex fistulas are bigger, and they might affect a lot of muscle, have branches, or be risky for people with other health problems. These might need more than one surgery, but doctors can use different methods. Like seat and drain, and a special thread is put through the fistula to keep it open and drain. It can also slowly cut through the fistula. Sometimes it stays in forever. Or endorectal advancement flap. Instead of cutting the fistula open, the doctor takes healthy tissue from inside your rectum to cover the opening. This helps it heal from the inside. It works sometimes, but the fistula can return. Or lift procedure. The doctor closes the part of the fistula between the muscles with stitches. They might also remove bad tissue. This is done after a seat and drain. It's not as effective as the first surgery, but it's safer for your muscles. Seventh question, what should I expect if I have an anal fistula? How you feel later depends on if the hole is simple or complicated. This decides how much treatment and healing you'll need. Usually, you'll need 3 to 6 weeks to get better after surgery. Sometimes the hole comes back after surgery, especially if it had many paths or if it's from a long-term sickness. People with IBD can get many anal fistulas near their anus. Eighth question. And last one. When should I see a doctor about an anal fistula? You should always go to a doctor if your anus hurts. Always see a healthcare provider about anal pain. Anorectal conditions that cause significant pain may be serious. Pain in that area can be a sign of something serious. Don't assume it's something that will go away by itself. Don't think the pain will just disappear on its own. Hemorrhoids may be more common and familiar, but they aren't usually very painful. Many people get hemorrhoids, but they usually don't hurt a lot. If a general practitioner tells you it's a hemorrhoid but the pain continues, see a specialist, like a gastroenterologist or colorectal surgeon. If your regular doctor says it's hemorrhoids, but it still hurts, see a doctor who specializes in that area. That's it for now. We've answered all the questions. But for more frequently asked questions about anal fistula, please check the list at the end of the video or in the description box below. And let's see you in the next video. Bye!